Can I start, sir?
Yes, we can start.
Good afternoon, everyone. I'm Dr. Kirti Soota from Dr. Makkar's Diabetes and Obesity Center. So before we start today's session, I would like to wish every one of you a very happy Lodi. Enjoy this Lodi to the fullest. Don't forget to put revdi, moongfali and popcorns in the fire, Lodi fire. They are supposed to bring good luck to all of us. And it is said that a family which celebrates Lodi together stays together forever. So wishing all of you a very, very happy Lodi from our side.
Happy Lodi to everyone.
This session of ours will be focusing on how to manage the various aspects of diabetes like diet, exercise, physical activities, and monitoring during the sick days. So today we have Dr. Makkar with us to brief all these things to us. Good afternoon, sir.
Good afternoon, Kirti. Good afternoon, everyone, and happy Lodi once again to everyone.
Again, we are under the third wave of COVID-19, and managing diabetes is very important during this period. Talking about the management of diabetes, we have to take care of the various aspects like diet, physical activity, medication, monitoring, and so many things. So let's start with how to manage all these things and manage your diabetes simultaneously. Diet, which plays a major role in the management of diabetes, is the most affected part during the sick days. We don't feel like eating and we have so many other issues. So let's discuss with Dr. Makkar today how to manage diabetes and diet during the sick days.
So it is very important because see, during the sick days, there are two things. One, you have some kind, whatever illness is there, usually there is a decrease in appetite. And then there may be, nauseating sensation that you feel like vomiting all the time. You may not be vomiting, but there may be tendency for vomiting. So that is again a challenge. So you have to make sure that you are taking adequate nutrition. Because if nutrient supply is not adequate, then your body's capacity to fight with disease is also compromised. So during actually, when you have any disease, you are in a catabolic phase. You are in negative metabolism. Your metabolic process is on the negative side. So you have to fight with the disease. You need more calories, more protein, adequate nutrition, adequate hydration, so that your metabolism stays as normal as possible. Or maybe, you have more efficient metabolic processes to combat the disease process or infection, whatever is there. Now, what happens when somebody is sick? Usually, people, one is there is decrease in appetite. Other thing is people think that if they will eat less, they will recover faster. So you don't need to eat less. You don't need to overeat because that may not be possible because of multiple reasons. And it is not good also because if you have a tendency of vomiting, you will vomit. You will have more fullness. You will feel more bad after a heavy meal. So you have to eat light meals. But maybe you can eat more frequently in the smaller portions, or you have proper meals at regular times, but make sure that you are not taking excess oil, or very spicy foods which further worsen the nausea or the GI upset. During any illness, usually there is, some amount of gastritis also. So again, there is feeling of indigestion. So it is very important to have good nutrition, adequate calories, adequate hydration, adequate proteins, so that your metabolism stays normal. Now, if somebody is diabetic, it becomes very challenging because on one side we have, given a structured diet to which is compatible with good glucose control. On the other hand, we might have to change the whole thing depending on patient's condition. So during diabetes, again, it is very important to maintain adequate nutrition. But person may not be eating sufficiently. So again, the formula is that person keeps eating smaller meals at frequent intervals. Second thing is, since the patient is not eating sufficient, there will be a tendency to go towards lower glucose levels. So you have to keep checking sugar levels regularly. At the same time, because of the infection or illness, there is a tendency to go to higher levels of glucose also. Whenever there is infection, there is increased demand for insulin in body, and that is why there is increase in the glucose levels if you are not providing sufficient insulin or if your medication is not working sufficiently. Now, particular to COVID situation currently, a lot of people get steroids as part of the therapy. Now, once you are anybody is given steroid, the steroids actually, increase the blood sugar levels very significantly. So people who are having a good controlled sugar in the range of 100 to 150, suddenly next morning will see their sugar going up to 300 or 350, and there is a panic reaction. And in these situations, again, you need to change medication. But second, once we are talking about diet, once person sees 350 or 300, person tends to eat less. That by eating less, I will bring down my sugar. But that is not going to happen. So irrespective of whatever is the medication you are on, or whatever are the glucose levels you are having during that period, your diet should be consistent. As long as you are able to eat, you should be taking adequate nutrition, whether it is as 3 regular meals if you don't have any nausea, any GI upset, or you have small, divided portions over 5, 6 times a day, does not matter. But one should take adequate nutrition, and at the same time, also continue with all the medication. Should not stop any medicine. And also keep monitoring the glucose levels. So nutrition is very important. Now somebody gets into a phase that somebody starts vomiting, or the appetite is very significantly suppressed. Then in that situation, one should consult the doctor, and maybe there is a need for giving intravenous fluids or uh, intravenous nutrition. So that can be decided by your treating physician.
Sir, you were talking about hydration and you laid stress on stay hydrated. So, what is the importance of this hydration and what are the consequences if a person is not taking proper liquid intake?
So, on an average, anybody in the normal state of health requires about 1.5 liters of water or liquids to take care of the routine metabolic needs. Now, why you need water? You want to maintain your blood in the proper liquid state so that the circulation is normal. Second thing is that circulation is going to all the other, parts, organs of the body. Now, kidney is the main organ which filters the whole blood every minute and filters out all the toxins that are formed during the metabolic process. Now, to filter out those toxins, you need about 1.5 liters of blood, of which normally what happens is about 500 ml goes into the insensible losses and the metabolic needs, and about 1 liter should go towards formation of urine. If you are sick, your temperature goes up, somebody is having fever, then there is sweating. So you lose water from during sweating. Because of your high temperature, your insensible loss of water increases through breathing. Somebody has a little difficulty in breathing, there is increase in the frequency of breathing, there is increased loss of insensible loss of water through breathing. And at the same time, because of the disease process, there is formation of increased toxic products inside the body which need to be filtered out or metabolized by liver. So there may be increased requirement for water to filter out the adequate amount, the toxins faster. So there is increase in the demand for water in body. Now this has to be met adequately. On the other side, your tendency to intake may be reduced because of nausea, because of decreased appetite, and so on. That is why we, commonly tell people that once you are having fever, you should take, coffee, soup, liquid, juice, so that hydration is good. At the same time, you are getting calories also, and it is not kind of causing, sudden distension of stomach, which is lasting for some time. Because if you're taking liquids, it doesn't stay in stomach for long, so indigestion will not be, much. So frequent intake of liquids is very important. If you have higher intake of liquids, it will give you a, good amount of urination, which will filter out a lot of toxins. Even if you sweat, you don't get into dehydration. If somebody is taking less liquids and having fever, now you are losing water in sweating, you are losing water in insensible loss, you need more water for urination to filter out toxins. If you are not taking adequate liquid, you may get into a state of decreased urine formation, which is oliguria. And at times, people get into dehydration also because there is not sufficient water. So there is decrease in blood pressure. If it is significant, it can lead to decreased, blood supply to kidneys. And at times, kidneys can go into temporary shutdown, which is acute renal failure, which can happen in these situations. So it can be risky also if you are under, hydrated. So proper hydration is always important. Maybe little overhydration is not going to affect unless somebody is a heart patient or already a kidney patient. There can one has to be very, cautious about how much liquid is to be taken, and that should be done in consultation with the treating physician. But a person who does not have any kidney or liver disease or does not have any heart problem, increased amount of liquid intake is always good for health whenever somebody is sick.
Perfect, sir. So you were talking about there can be a decrease in the blood pressure. So do we need to take care of the hypertension medication also?
Yes. So whenever somebody is sick, one, it is very important to keep monitoring blood pressure also. See, there are some vital parameters we always monitor for any person. One is pulse. Pulse is a very good indication of the overall state of body. So if you are in the range of 50 to 100, you are generally normal. Whatever your normal is, 10%, 15% in plus minus, if you are ranging in that, it doesn't. If you get fever, normally you will see pulse rate will go up. Somebody gets into dehydration, the pulse rate will go up. It will indicate that your BP is going to, BP falls, again the pulse rate goes up. Some kind of, there is a significant disease process in the body, the pulse rate will go up. So anything relating to heart, the pulse can go up. So their pulse is a very important clue. So one, pulse rate. Second is respiration. Somebody is breathing normally, 99%, there is not much of an issue. Somebody's breathing is getting disturbed, it is a major problem. We have to, so we always talk of airways, blood pressure, and C is the consciousness level. Somebody is conscious, fully oriented, you know that there is no major sickness. Somebody is getting drowsy, not talking normally. These are indications that there is a serious illness. So monitoring, simple monitoring of blood pressure, maybe twice a day, gives you a good clue whether your BP is normal or going low. And if it is going low, one should get in touch with the doctor if somebody is on, BP lowering medication. And those may need to be reduced temporarily during the illness period. But after the recovery, again, during, you will know by monitoring when your BP is going back to the normal or higher levels, you need to start the medication.
So you also stated one thing, your blood sugars may go down also, your blood sugars may go up also. That means we can know this thing by monitoring. So now I would like to know from you is what should be the frequency of monitoring and how to properly do this monitoring.
So it is very important to keep a track of how the sugar levels are behaving. So first thing is thing is that we don't want any patients to go into hypoglycemia. So everyone who has diabetes, and also preferably their near and dear ones who are staying with them or their first degree relations, should know what will happen once there is hypoglycemia or low sugar levels. The common symptoms are uneasiness, commonly, termed as ghabrat, uh, low feeling, palpitations, tremors, headache, feeling of extreme hunger. You feel person feels like as if person is going to die if doesn't eat something, or clouding of consciousness, irrelevant talking, incoherent talking. Person may be behaving as if some person has suddenly become drunk, or declining consciousness. Person becomes unconscious. But unconsciousness stage is, it comes late. Usually, person will get enough symptoms. Now, we teach everybody to remember these symptoms as indicators of impending low sugar or development of low sugar levels. Now, problem is most of the time people don't even remember what has been told to them. And we have seen in our clinical practice so many times. The general rule is any problem, any given time, first reaction should be to check blood sugar. Normally, what people do is check their blood pressure. But blood pressure doesn't give you a alarming, situation. Alarming situation is usually because of the low sugar. So if any problem somebody is feeling, first thing is to check sugar. And if the check sugar levels are going less than 70, then it is low glucose level or hypoglycemia. And one should immediately consume either some free sugar equal to 15 to 20 grams of sugar, or 20 to 15 to 20 gram of glucose, preferably dissolved in a glass of water, or some simply eat and drink a glass of water over that, or about 150 ml of a liquid sugar drink like fruit juice, like Pepsi, or whatever. So, Ruh Afza is normally available at home with most of the people in North India. So these things can be utilized. Liquid form of glucose which gets absorbed faster. Normally what people will do, they will take a cup of tea with half spoon of sugar. That is not required. You have to take excess sugar. And within 15 to 20 minutes, if you are not feeling okay, check your sugar again. If your sugar has not gone above 90 to 100, take that sugar or sugar drink or glucose again. Make sure that your sugar levels have gone above 100. And after that, take your regular meal, which will give you a sustained increase in glucose level up for the next few hours. Now, important thing is, if you get low glucose level, you have to lower the dose of your glucose lowering medication, which usually is told by the treating physician to the patients. If you are not sure, get in touch with the doctor. That is more important concern. Now, once your dose is adjusted, you should be okay, and your sugar levels should come towards normal, or maybe they will stay high for a day and then come back to normal. That is the first thing you have to keep in mind. Now, usually the lowest level of sugar is early in the morning because you have fasted overnight. So that is the normal low fasting level. And that is the usual lowest level, unless somebody is dipping during night or somebody is taking medication at night, which brings down to very low sugar levels during night. So that gives you a good clue how is your fasting behavior. Second thing is you have to keep checking your sugar after meals. You have to see how much sugar is going above your baseline after the meal. So best is to check fasting and 1.5 to 2 hours after each meal during the sickness period. Now, if your fasting is high, that means all your sugar levels are going to high, because post meal glucose values will start with the fasting level. So you have to accordingly readjust the medication dose. Second thing is, if somebody is getting steroids, particularly during COVID period, they may be having normal fasting, but post meal values go up suddenly, because once they have taken the dose, after 1 hour or so, the sugar levels shoot up like they go through the sky, and they may come down to the near normal values late in the night, right? So all these things you will know only if you are checking regularly. So ideal would be to keep checking fasting and all three post meal values 1.5 to 2 hours after each meal. And also, slightest problem, intermittently you must check your sugar levels. And if you are not controlled, you should be in touch with your doctor for modification of treatment or whatever is to be done for the COVID therapy as well as diabetes therapy.
Sir, am I audible?
Yes,
Hello?
very much audible.
Sir, am I audible?
Yes, yes, you are audible.
I think I have some signal issues over here.
No, no, we can hear you.
Okay, sir, so my next question to you is, we always talk about exercise for diabetes management, and I think exercise is also the most affected during the sick days. So how to manage exercise during sick days?
So, it is important to keep in mind that when you are having any illness, you are in negative metabolic state or catabolic state. That time you should not be exercising. You should maintain good mobility if you are able to comfortably place, but you should not be exercising because that can further worsen your disease process. So during that time, body needs rest. So one should take rest. Not exercising during the sickness period is not going to worsen anything in long term. But during that period, you should stay rested because your body needs to conserve all the energy to fight the disease.
Right, sir.
And you should be having adequate protein intake and nutrition also to combat the disease.
Perfect. So another very important question is about the over-counter medication. What we have experienced during the previous waves is there was an excess consumption of the OTC medication during these waves. So is it okay for a diabetic, or is it okay?
So I personally feel, one should not be taking any medication without the advice of the treating physician, because half the time person cannot make out, or most of the time people cannot make out, what they are buying over the counter is compatible with the person's existing treatment strategy or no. So there may be drug to drug interactions, or second thing is, if there are no interactions, most of the time what they are buying over the counter in the garb of nutrition supplement, or something going to help them during the epidemic, is usually nothing more than a placebo and may be harmful. So many things see people are using aloe veras and giloes, and we have some people who are advertising all these things, but it is best to stay away from all these things and take only the medications that have proven efficacy and that are advised by your treating physician. I don't think anything else is going to help. And another important thing that is happening during these periods is there is a WhatsApp and Facebook prescription which will be circulating in everybody's one or other group. So last year, or this year, it is fortunately less. Last year, I was seeing COVID patient. I would write a prescription, and by evening, some patient will call, डॉक्टर साहब आपने मेरे को स्टीरॉयड तो दिया ही नहीं है. So I asked him, why do you need a steroid? डॉक्टर साहब बट मेरे फ्रेंड ने अपना प्रिस्क्रिप्शन भेजा है, देखो उसको ये दवाई दी हुई है, आपने तो मुझे इसमें से कुछ भी नहीं दिया, तो मेरे को ये लेनी है कि नहीं लेनी है. Now friends are advising them to take steroids. Today only I have seen a patient who has COVID for 4 days and was already on steroid. And only mild COVID. Person does not have anything beyond cough. On 3 antibiotics, 1 antiviral and steroid, of which nothing is required actually. So there is a lot of wrong information which is percolating down the social media. So please do not pick up ideas from social media. Please stick to the prescriptions that are given to you by your doctors and follow the advice. Don't go for over-the-counter medication. Don't go follow the WhatsApp Medical University or Facebook University. They are not going to help you during this period. They can only spread panic. They don't tell you that, look, this time COVID is mild, you should not bother, just stay rested at home. Maybe you don't need any medication, just get in touch. No WhatsApp message tells you that get in touch with your doctor. Have you ever seen a message on WhatsApp that if you have COVID, please consult your doctor? No. So there is a lot of wrong information or misinformation, which I think one should stay away from.
So let your doctor decide the best for you.
Yes.
So any other thing you would like to add?
So monitoring is we have already discussed. So in addition to glucose monitoring, again I would like to emphasize that one should keep checking the blood pressure levels also. Routine monitoring of blood pressure. Most of the people, unfortunately, have a pulse oximeter at home, but they don't have a glucometer or blood pressure instrument at home, which are more important monitoring devices than your pulse oximeter, or your oxygen level measurement is required only when somebody is becoming breathless or having breathing difficulty or has severe COVID, significant chest infection. Routinely your oxygen saturations don't get affected, and the current scenario where this Omicron is affecting only the upper respiratory passage, it is not affecting the lungs largely. So chances of your getting low oxygen levels are very less. But more important to monitor is that even if you are not diabetic, at least check your sugar once. Just make sure you are normal, because during stress situations also the sugar levels can go up. And also keep monitoring your blood pressure, which is more important.
So what I feel is managing diabetes during sick days is very important, and all the aspects should be taken care of very properly, which includes diet, hydration, medication part, monitoring, OTC medication, and definitely, yes, warning signs and symptoms, which Sir has already focused on.
And in addition, make sure that don't forget to monitor your sugar 3 to 4 times a day. Whatever your monitoring habits are, even if you are not checking before the illness, during illness, you must check at least 4 times a day.
And Sir, any other message you would like to convey?
No, I think the most important message right now is that stay away from the crowded places. Try to stay home as much as possible and stay safe. Avoid getting infected, even if it is mild infection. You never know who gets infected badly and who gets into complication. So it's best not to get infected and prevent infection.
So my request for you today is just go through the comment section if we have to answer to any questions.
Give me a second.
Yes, sir.
Mhm. I am not seeing any comments right now.
So then we'll answer in person if we
Yeah,
have.
we can answer later on. That's not.
So can we close the session?
Yes, we can close the session. Thank you everyone for joining once again. Hope to
Thank
see
you,
you
everyone.
next week at the same time. Thank
Thank
you,
you.
Dr. Kirti. Thank
Thank
you.
you, sir. Thank you.